Maximizing Adolescent Potentials is a research, public service, and training program dedicated to the prevention of drug and alcohol problems among youth, the promotion of adolescent mental health, and the development of capable young people. MAPS works with schools, families, communities, children, and adolescents in a variety of settings. MAPS is a program of the University of Pittsburgh School of Education Health and Human Development Program. The following is a snapshot of programs we offer to you and your school.
Now that you know what MAPS is all about, you may be asking yourself, what is SAP? SAP, as it is commonly referred to, stands for the Student Assistance Program, and it is a team of school personnel, such as teachers, administrators, school counselors, and nurses, along with agency personnel, such as behavioral health liaisons from MAPS. This team is available to help you access school and community services for your child. In Pennsylvania, every school district is required to have a plan and a team for identifying and assisting students who experience barriers to learning. Your school's SAP team will help you find services and assistance within the school and, if needed, in the community as well. We do not diagnose, treat, or refer your child for treatment, although we will make recommendations and we will provide you with the information to help make those choices that best fit your needs and your wishes. We will provide support and advocacy and connections to you and your child in order to try and reduce barriers to learning and help your child to reach their full potential and beyond. As the parent and guardian, you are a vital part of the team and the entire SAP process. We will further explain what that looks like.
How to make a referral to the Student Assistant Program. Anyone can make a referral to SAP. Administrators, school counselors, teachers, parents, guardians. A student can even refer themselves to SAP. Every school district has their own referral form. Once the referral form is filled out, it is given to the SAP coordinator and brought to the SAP team, where it is then decided if it is an appropriate referral for SAP. Most referrals are appropriate, but sometimes referrals are moved to a referral for PBIS, MTSS, or SST, or some other academic behavior support team a district has in place. Once the SAP team decides a referral is appropriate, a case manager is assigned. The case manager will send home or email a parent permission form. The Student Assistant Program is a voluntary program. Any parent or student over the age of 14 voluntarily decides if they want to participate in the program or not. The case manager then collects data relevant to supporting the student to break down whatever barrier to learning they are experiencing. Attendance, grades, discipline records are all collected along with a teacher input form and a parent input form. The SAP liaison will look at this data and, if given permission, will then conduct a behavioral health screening, which you will learn about next.
Have you noticed a change in your child or student's behavior? Are they more withdrawn this year from family, friends, and activities they once loved to do? Are they having trouble making connections socially at home or in the community? Are they feeling sad? Are they defying authorities at home and at school? Are they acting out aggressively, lying, hitting? Have you noticed a decline in their grades? Are you concerned because they may be using alcohol, drugs, tobacco, or vaping? Have you noticed signs of depression, anxiety, or stress? Are there family concerns? Is there a recent divorce, loss, or death of a loved one? Did you recently move into a new community? Has there been a change in your child or student's attendance? Are they having trouble with their relationships? Is there bullying, self-harm? Was there a traumatic event recently that affected them? These are the behavior concerns and changes that we are looking for when we do a SAP referral. Keep in mind, when you do a SAP referral, COBS, concrete observable behaviors.
Next is the behavioral health screening. MAPS provides a free, confidential screening for SAP-referred students. Once the MAPS liaison receives the signed consent form from the parent, the screening can begin. It's called the CANS, which stands for Child and Adolescent Needs and Strengths. The goal of the screening is to help identify barriers to learning and identify the student's strengths. Following the screening, the MAPS liaison contacts the parent and the SAP team to notify that the screening has been completed and provide some recommendations. SAP screening recommendations may include supports for the student, such as checking in during the school day, inclusion in a social, emotional, or skill building group, providing information about school-based mental health services, providing information for outside therapy, crisis hotlines, and other resources available in Allegheny County. The MAPS liaison in your school building is available to facilitate groups and follow up one-on-one with students. The MAPS liaison works closely with the school counselors and the staff, and it's another person to build rapport with students and their families and provide support in the school setting. All SAP information remains completely confidential, and if you have any questions, you can contact your MAPS liaison or another member of the SAP team.
Through the use of a countywide needs assessment, prevention providers identify the risk and protective factors of the community in order to develop effective interventions. Alcohol, tobacco, and other drug risk factors typically relate to the question, what conditions in the school, community, and family and self might contribute to the development of youth ATOD use. ATOD protective factor research typically focuses on cases in which youth experiencing substantial risk of ATOD problems choose to avoid drug use and asks, what resources can be put into place that will lower the youth's risk for ATOD use? In other words, what supports can we put into place to combat the community norms, social acceptance, and family history of use? Using the risk and protective factors drawn from the needs assessment, we develop a logical and effective plan for prevention programming using the federal strategies identified by the Center for Substance Abuse Prevention. The 6 federal strategies are information dissemination, which provides awareness and knowledge on the nature and extent of alcohol, tobacco, and drug use, misuse, addiction, and problem gambling, and the effect on individuals, families, and communities. Education activities are an attempt to affect critical life and social skills, including decision-making, refusal skills, critical analysis, and systematic judgment. Alternative activities operate under the premise that healthy activities will deter participants from the use of alcohol, tobacco, and other drugs, and participation in gambling activities. Therefore, minimizing or eliminating use of alcohol, tobacco, and other drugs, and participation in gambling activities. Problem identification and referral supports persons who have participated in the illegal or age-inappropriate use of tobacco or alcohol, and those who have participated in first use of illicit drugs in order to assess if their behavior can be addressed through education. The community-based process aims directly at building community capacity to enhance the ability of communities to more effectively provide prevention and treatment services for substance use and problem gambling disorders. Activities include organizing, planning, enhancing efficiency and the effectiveness of service, interagency collaboration, coalition building, and networking. Environmental activities establish or change written and unwritten community standards, codes, ordinances, and attitudes, thereby influencing incidence and prevalence of the use, misuse, abuse of alcohol, tobacco, and other drugs and problem gambling in the population. Maximizing Adolescent Potentials works with children, adolescents, families, and the senior population to address issues related to ATOD, while also providing awareness and supports related to gambling prevention in the community. Prevention specialists provide alcohol, tobacco, and other drug prevention education programs in the classroom and small group settings in elementary, middle, secondary, and communities. This includes life and social skills, leadership development, bullying, cyber safety, etc. Staff can implement evidence-based programming in schools and the community while also adapting from curriculum and resources to meet the specific needs of your group. Some of the evidence-based programs you may be familiar with include PATHS, Second Step, Project Ophelia, Life Skills Training, Strengthening Families and Girls on the Run. Prevention specialists offer training workshops in the community as well as elementary and secondary teachers and administrators and other prevention professionals and human services personnel. Some of our training topics include youth mental health first aid, trauma-informed care in classrooms, working with at-risk youth, fetal alcohol spectrum disorders, and so on. Community programs for seniors to educate on gambling and where to turn if they feel they have a gambling addiction is another area of focus. MAPS has a long history of providing violence prevention programming to at-risk through the collaboration with school and community-based organizations. Our programming offers information to participants on ways to cope with traumatic events, peace building, and violence prevention through the collection and commitment to peace. We have a team of creative professionals offering innovative and cutting-edge work throughout Western PA. If you have a need or program idea, we may be able to help. Jennifer Eli is the Executive Director of MAPS and adjunct faculty in the School of Education's Department of Health and Human Development. Dr. Eli is responsible for the oversight of alcohol and other drug programming and mental health intervention services in participating schools and the community throughout Allegheny County. Dr. Eli supports program development with a team of professionals while consulting with school districts on identifying needs and strengths to ensure at-risk students receive the support to succeed academically and emotionally. Dr. Eli's role as Executive Director provides an opportunity to represent MAPS at the local, county, and state level. Dr. Eli has expertise in community collaboration, conducting school and community-based needs assessments, and implementing evidence-based programming. She has been invited to present at several local and national conferences on the topics of child and adolescent development, evidence-based interventions, and addressing needs of at-risk youth. Megan Roman serves as the Social Services Liaison, SAP Liaison, and Coordinator at Kerr Elementary in the Fox Chapel School District. As part of the student assistance team, Megan concentrates on the whole child in terms of providing support and addressing challenges the student may be facing. She performs child, adolescent needs and strengths trainings in order to identify any barriers to learning or areas of need and helps to activate their strengths. Megan works with families to help connect them with community resources as well as school staff in order to set up a support system during the child's school day. Megan conducts various small groups with students to address current trends such as social skills, healthy friendship, relationships, self-regulation, and relational aggression. Megan is also part of the school crisis team in which she helps to intervene to de-escalate a child and the situation. Megan received her Bachelor of Arts from St. Vincent College and worked for the Commonwealth of Pennsylvania after graduation for several years. In 2012, Megan took the position as Education and Community Outreach Coordinator at MAPS. In 2017, she accepted her current role. Outside of work, Megan loves to spend time with her family and friends, especially watching her adorable nieces and nephew grow, and enjoys trying out new hobbies and talents. She has a passion for hot yoga and running. She participates in various races in order to raise money for different charities that are near and dear to her heart. She feels extremely grateful and blessed that her life's work is to help and support students to realize their full potential, and their presence makes a positive impact in this world, and that her students can find hope in any situation. David Frazier is the Social Services Liaisons for Fox Chapel Area High School and O'Hara Elementary School, working with the students and families of the Fox Chapel Area School District to help connect them with community resources. David focuses on resources that will benefit each individual. He engages with students one-on-one as well as conducting groups to address issues such as anger management, social skills, and conflict resolution. David monitors the treatment and recovery of students who have violated the drug and alcohol policy of Fox Chapel Area School District, assisting with compliance to the school's policy in relation to state guidelines. He is an integral part of the student support team, monitoring mental health services and supporting students to achieve their academic goals. David has been a guest speaker on subjects ranging from mental health resources to suicide prevention and awareness. David holds a bachelor's degree in sociology from Lock Haven University and a master's degree in applied developmental psychology from the University of Pittsburgh. Prior to his position with the University of Pittsburgh, David had a comprehensive career in the mental health field, working with patients in both inpatient and outpatient settings, most recently in crisis intervention. Initially working in an inpatient setting and then an outpatient setting in rural Pennsylvania, David moved to Pittsburgh, which opened up a wealth of new experiences. While working in mental health crisis intervention, David decided that he wanted to pursue a career helping at-risk youth. The MAPS program has given David a warm welcome and fostered growth and change while allowing him to pursue his goals to help at-risk youth in the community. David enjoys spending time with his wife and son watching baseball, playing basketball, baking, and engaging in other outdoor activities. Bevan Kovalik is a social services liaison in the Fox Chapel area school district, primarily working with the middle school and elementary schools. Her current role is screening students to identify barriers to learning, identifying indicators of anxiety, depression, and other mental health issues, and to discuss the risks of drugs and alcohol use. In addition, Bevan works with school staff and SAP team members to help provide students with social emotional support and interventions during the school day. She makes recommendations and helps students and their families connect with mental health resources and other community resources in Allegheny County. Bevan has a master's in social work degree from the University of Michigan in interpersonal practice with children, youth, and families, and a bachelor's of arts degree from the University of Notre Dame. Bevan has a 20-year experience as a clinical school social worker and mental health professional working with children and families from the preschool to high school level in southwestern Alaska, Ohio, Michigan, Vermont, and New Hampshire. Bevan has been part of the MAPS department at the University of Pittsburgh since 2019. Outside of work, Bevan loves hiking, camping, baking, and spending time with her family. L'Oreal Trudeau is a behavioral health liaison with the University of Pittsburgh MAPS program. She has worked with us since 2015, helping elementary and middle school students to overcome their barriers to learning. She helps them to become more understanding of their feelings and learning. She connects students and their families to community services when needed. In addition, she provides supports to students, families, and school staff to help their students to become successful at school. Lori provides classrooms with social emotional learning lessons and also has groups about friendship, communication, feelings, and anger, along with other social emotional groups. Lori loves to watch students transform into individuals who understand their feelings better by the end of each year. Lori received a Bachelor of Science in Psychology from the University of Pittsburgh and a Master's of Science from Clarion University, and started working as a case manager and also worked in the behavioral health field. She has worked as a student assistance liaison in several school districts throughout Allegheny County. She has also worked as a mental health therapist. Lori then went back to school and received her master's degree in counseling psychology from Chatham University and achieved her LPC. She has a passion to help all the students she meets. They all know how important a smile can be. Lori is the mother of 3 children and is proud to have a boy-girl twins. She loves spending time with her kiddos and watching them play soccer, basketball, taekwondo, sing, and dance. Her family enjoys boating, bike rides, and hiking. Her kids also love to experiment, explore, and create new things. Dana Heisel serves as a behavioral health liaison for Chartiers Valley School District. She is an integral part of the student assistance program within each building K-12 in the district. She works to identify students' strengths and needs and helps to connect them to appropriate supports both in school and within the community. Dana also runs several student groups within the district, focusing on social emotional wellness and prevention needs. In addition to her work with students, Dana also provides support to staff and offers up-to-date information, trainings, and resources relevant to supporting the well-being of all students. Prior to joining with University of Pittsburgh, Dana had an extensive background in crisis work, mental health services, and education. After receiving her Bachelor of Science in Child and Family Studies from Ohio University, she returned to Pittsburgh and began a career in the mental health field. During this time, she worked with various populations throughout Allegheny County to provide mental health, and eventually crisis services. She went on to receive her master's in education in school counseling from Indiana University of Pennsylvania, which allowed her to follow her passion to work with students in need. In this capacity, she served as a school social worker and later an outpatient school-based therapist to support, advocate, and guide the most vulnerable students while helping them to break down barriers to learning and, in turn, increase their overall wellness and positive mental health. When she's not working, Dana enjoys spending time with her 2 children, her husband, and dog. They enjoy spending time together outdoors, boating in the warm months, cheering on Pittsburgh sports teams, cooking, and just relaxing with friends and family. Kara Kelly is a behavioral health liaison, mental health professional with the MAPS program. She serves as a student assistance liaison supporting school district SAP teams in Allegheny County. The main focus of her current position is to screen students K-12 using the CANS assessment tool to identify students' strengths and needs within the school environment and community. Connecting individuals and families with resources and supports is another aspect of her position. She runs several groups each year, including grief groups, social skills groups, and drug and alcohol educational groups. She is heavily involved in helping school districts and the community by providing them prevention information, evidence-based prevention programs, and trainings that have a positive impact on well-being and mental health. Kara has 19 years of experience in the mental health field, working and supporting school districts in the community. She obtained a Bachelor of Arts in English Communications from Gannon University and a Master's of Education in School Counseling from Slippery Rock University. Her passion is for helping others improve their well-being and mental health. She takes pride in advocating for students and families and doing whatever she can to help make a positive difference in someone else's life. Kara is married and has 3 children. When not working, she is very busy watching her children's sporting events, boating, volunteering, cooking, and making time for the occasional binge on Netflix. Julie Rapino has a Bachelor of Arts in Psychology, serves as prevention specialist to MAPS, and supports school districts in Allegheny County. She is currently working on her Master's of Science degree in the University of Pittsburgh Health and Human Development Department. She has 20 years of broad experience in various disciplines, including extensive training in crisis, drug and alcohol counseling, and educational support. She has served in these capacities supporting all age groups from children and adults with special needs, children and adults in crisis, and seniors facing care questions and end-of-life decisions. Additionally, she has served in case management roles with adult offenders in the state penitentiary system and adolescents in the juvenile court system in Allegheny County. Janaea Edwards holds a Master's in Human Services and serves as the prevention specialist for the University of Pittsburgh MAPS program. As a prevention specialist, Janaea has the opportunity to work with students in and around the city. The focus of her position is to educate our youth and families about substance abuse and other high-risk activities. Janaea encourages youth to live a drug and alcohol-free life. She also assists and educates younger students on proper social and coping skills. Janaea has always had a passion to work with children, youth, and families. She received her bachelor's degree in psychology from Edinburgh University in 2007, and in 2015, she received her master's degree in human services from Argosy University. Prior to coming to Pitt, Janaea was an early childhood educator. She believes giving children a great educational foundation will put them on the right path towards a great future. Janaea is a mom to 1 son and 1 angel baby. In her spare time, she enjoys watching her son play sports and participating in his drum recitals. She is also very active in her church. She serves as the leader of the youth group and the dance and mime ministry. To access services through the University of Pittsburgh MAPS program, give us a call or send an email to Jennifer Eli, or reach out to a familiar face in your school